Go on.
When you was talking about the antibody panel, you said when we're talking about the family and we don't have to cancel the family, that's the heterozygous ones. But in a situation where we do not cancel and we are left with that, you said we'll further confirm with phenotype.
Yes, that's part of
Yes, so okay, yeah. So if me, I'm giving the sheet like this, what do I? There's no way to do phenotype. So what do I?
So what you then need to do, that's why you know what to do. So if at the end you say, okay, this is the antibody, this is the antibodies I'm suspecting, this is what I've isolated, but I cannot exclude this. Are you getting me? What you now left with an option of, but however, it is a non-clinically significant antibody or whatever. So if it is non-clinically significant antibody, just state it. Can't exclude KPA or can't exclude CW. However, is a non-clinically significant antibodies, and I'm just going to get the antigen negative of the one clinically you've isolated and then cross-match. Does that make sense? But what I meant was that, again, is that sometimes what you cannot exclude has to do with clinically significant antibody. For example, you've isolated maybe anti-big C, anti-Duffy A, but you cannot exclude maybe anti-S. Let's say anti-S. You can't exclude anti-S. So because anti-S is clinically significant, what you then need to do is to do what we call extended phenotype. Okay? You then need to do phenotype. So that phenotype you're going to do is to confirm whether the person has got the antigen. If you remember, I explained to you that when phenotype measures the IgG antigens that are on the surface of the red blood cells, and I said that when we do antibody panel and the antibody panel or antibody screening is positive, that for the fact that antibody screening is positive and we identify the antibody and we identify the antibody that is present, are you getting me? What it then means is that technically the person does not have the antigen. Every antibody panel you did that shows you a particular antibody, it means that the person doesn't have the antigen. That's what it means. Because it means that because the person doesn't have the antigen, that was why the person acquired that antibody, because the person developed that antibody. That was why I said, if peradventure the person has got the antigen, then it's no longer allo antibody, it becomes auto antibodies. Do you understand? So if we cannot exclude, we've done first line panel, second line panel, we've done all we can, but we cannot still exclude a particular antibody that is clinically significant. Very simple. Do phenotype. So when you do the phenotype, if the let's say what you are suspecting now is anti-S, and you can't exclude it, so you do phenotype of anti-S against the patient. If the patient has the anti-S, then it doesn't matter because it has it. It means that even if you give the person blood that is anti-S, antigen S positive, it doesn't mean anything because the person has the antigen. But if you do the anti-S phenotype and it is negative, that means the person does not have the antigen. So if you know the person does not have the antigen, what it means that you've done the panel, because panel shows you the antigen the person doesn't have. That's why it's positive. So the opposite is doing phenotype. So phenotype, I've said the person doesn't have the antigen. Because you know the person does not have the antigen, you need to prevent giving the person blood that has that antigen. Does that make sense? So that is opposite way of doing, like a way of doing antibody panel, because what antibody panel will show you is that this antibody is present and it means that the person doesn't have the antigen, and phenotype will show you whether somebody has got antigen or don't have the antigen. Does that make sense?
Yeah.
But that's just what you need to do.
Right. Yeah, I think that's that about that. It's just the remaining the questions now.
Okay, that's fine. Right, that was why. Let's look at this. First of all, when we go for interview like this, our composure is very, very important, which I think you've been doing okay anyway, because that's why you are grabbing job everywhere. Hopefully this one will be the one that can help you to make decision.
Yeah.
All right. Now, the secret is using example. Don't forget. So when you answer question, make your question not just to be is a process. It can be defined as just do. I'm not saying don't do that, but don't bring it home to what that goes on in the lab. Okay?
Yeah.
And when you are giving your answers, try to make it look like you are chatting with them than you are giving answer. I'll give you an example. Let's say they ask you what is electronic issue. You could say, just watch what I'm going to do now. You could say, electronic issue is a process in which we are able to issue blood without doing a physical serological cross-match, okay, provided that the person has no history of antibody and has got a current blood group. Does that make sense?
Yeah.
You are correct. But imagine saying something like, electronic issue is actually a vital. I'm answering the question now. You could say this is very, very vital in blood transfusion because it is one of the ways of issuing blood by doing computer cross match. So what happened in this situation is that first of all, we check whether the person has got a current group. Are you getting me? If the person has got a current group, we check whether the person has got any historic antibody, as the case may be. So if where there is no historic antibody, where there is current group, then it means that the person is eligible for electronic issue. So with the electronic issue, then we can now do a computer cross-match by using computer to issue that blood to that patient without necessarily doing a cross match. So electronic issue is a computer cross match in which we are able to issue blood to any patient that has got a current group and no history of antibody. Do you understand what it means? So
Yeah.
you gave it as a chart. You are not, it's like you're discussing with them. And by the way, while we are here, let me ask you a question. If someone is pregnant or within childbearing, okay, let's say any woman within childbearing age, which blood must you give them?
Kel negative.
Antigen K negative. Antigen K negative. Okay, that's correct. All right, let's do this. So the first question here is, what sort of things have you done previously that you think make you a good biomedical scientist? What sort of things have you done previously that you think make you a good biomedical scientist? So the problem with this kind of questions is open check. What are you going to write in it? Now, again, somebody could run off and say all kinds of things, but you could say something like, first of all, let's find out before we define it or before we tell them the answer. What do you think this question is talking about?
It's talking about your experience. It's talking about how do you think you're able to handle pressure. It's talking about your qualities. It's talking about.
So let's talk about pressure.
Yeah.
I'm trying to make it pressure. What again? Quality. What
qualities. How you lead. Are you and also work in a team.
Okay. Yeah, team player. That's actually vital aspect of this one. Maybe leadership.
Yeah. And your how do you validate? How do you use your apart from because in some instances where you get results, how do you use your knowledge
skills,
technical skills to like judge?
So you know why I asked you this question? It's important you know what you want to tell them. Let's start with team player. What do you think someone can do that can make the person feel like he's a good biomedical scientist when it comes to a team player? We are not answering this yet. I'll tell you what to do. I just want us to think about it first.
Being collaborative.
Okay, collaborative. When you say collaborative, what exactly do you mean?
I feel.
Don't take your eyes away from the focus of this question. Is what you have done that make you think or that make you a good biomedical scientist? Let me give you a real-time scenario. Okay. So let's say we are working together.
Yeah.
And I have done something in the lab and I hand it over to you. And you notice there was a mistake from what I have done, and you spotted that out and corrected it. Are you getting me? And obviously reported it to the senior. That is a team work. That is also quality. Quality, are you getting me? So that is very, very important. Now, let's say I validated a result of race MCHC and you decided to do the blood film. Are you getting me? When you are doing the blood film, you notice that I validated a full blood count of race MCHC without warming the sample up to see whether it can correct. Do you understand me? Okay. Because when you look at the blood film, you start seeing some agglutination, which is a suggestive of what? Cold agglutinin. And you notice that you now check the MCHC and find out that it was very high. So you were surprised that I did not warm this. Do you understand the point now? And you spotted that thing out and go and warm the sample and repeat the full block and the MCHC becomes normal. Do you understand me? So you are, and you remove the old result and replace with this new one. You have, that is what that can make you a good biomedical scientist. Ability to pay attention to detail and ensure that you follow standard operating procedures strictly to achieve, desired results. Does that make sense? Okay. So now, but it's a real-time scenario. So that's one scenario now. So imagine another scenario as well where a colleague of yours, maybe if we can paint a real-time scenario, that will make sense. Let's say a situation whereby a colleague of yours were unable to, identify whether or not a sample was due to O sample or not. Are you getting me? Okay. So, and the person showed you the result and you check it, that even though the result appear normal, are you getting me, on the screen? Do you understand me? So, but there were a little discrepancy, like in terms of the race MCV or race MCHC, but your colleague wasn't very sure because the other parameters appear very good. Do you understand me? And it wasn't very clear whether the sample was an O sample, especially because the colleague has warmed the sample and the MCHC was still not done and all of that. Then when you look at the scattergram, now, this is where experience comes in. When you look at the scattergram, if you remember my video, if you see the Y cell count stay together, do you understand me? That shows you that this is an O sample. Then you told your colleague that looking at the scattergram, that they can see that the scatter plot of the differential Y cells are all put together. Do you understand me? That this is a strong indication that this is an O sample. Hence, we need to reject this sample and ask for a repeat. And when the sample was repeated, the scattergram was clearly separated and there was no race MCV and MCS. So that's your suggestion you gave to that your colleague is again what will make you a good biomedical scientist. A good biomedical scientist as well could be somebody that you say there was an occasion where you've done QC, then you notice that even before the time you perform that QC, that your colleague, they've been validating the QC, and this QC has been passing like maybe plus or minus 1 point, maybe let's say 1.89. Do you understand me? Standard deviation. Do you understand me? Even though it's passing, but your concern was that it's getting close to the +2 or -2. And it was surprising that the trend continued like that. Nobody bothered to investigate it. Do you understand me? And you then decided to investigate it. And when you investigated it, one of the things you found out was that the vial of the control sample that was used, are you getting me, has been in use for more than 7 days. Are you following now? Okay. Then you decided to bin that one and get a new vial, and you were able to get a standard deviation of maybe +1 or 0 point something standard deviation. That again, and of course, when you notice that, you also notified your senior, because it's important that when such a thing becomes consistent, that we investigate it. You can also be a biomedical. I'm giving you scenarios. It's up to you to pick one. That you're also a good biomedical scientist, because there was on this occasion that you noticed that your quality control sample has begun to fail. Do you understand me? And upon your investigation, you'll find out that the calibration curve can be betterly performed. Do you understand me? Okay. The curve were not, I don't know what they call this thing in statistics, the X square or Y square, something like that. It's supposed to be close to 1. Maybe if you get like 0.99, that is better. So you notice that Y square, is it Y square or S square, is like 0. Maybe 84. Are you getting me? And it was accepted that impacted on the calibration curve, or the curve in which the sample, the analyzer is running. Then because you notice that, then you decide to recalibrate the analyzer. Are you getting me? Again, bringing it up close to 1, and that make the QC to begin to pass. That's a good biomedical scientist. Do you understand me? So you noted that on this occasion you came to the lab and noted that the fridge temperature chart, nobody has been filling it up. Do you understand me? There was no any indication, it has not been filled up the way it's supposed to fill, and this happened over the weekend. Do you understand me? And then what you did was obviously to report it, obviously, because that is important. That will keep in control of what is going on. That's a good biomedical scientist. You are also a good biomedical scientist because there was a time of maybe UCAS accreditation, and you contributed significantly because you were part of the team that shows the inspectors maybe a particular test, that what you show them, you can mention a test, maybe PTR or whatever you want to, routine coagulation or ESR, or whatever you want to tell them. You show them what you guys are doing, and the way you demonstrated your knowledge when they were watching you and all of that. They gave the management a good feedback regarding your performance. That means that you've also contributed in the performance of the team. Do you understand me? So these are all kinds of scenarios. So this kind of question, we must paste example. That's what I'm saying. It's not time to run off with answers. There has to be a real-time example of what you are doing. You can also say you are a good team player because, you are you feel like a good biomedical scientist because you spotted out that maybe sometimes it is in a lab where you've worked before, that it became unclear when it is an urgent sample and when it's not an urgent sample. And then when you guys were having a meeting, you suggested that it is important that we have a way of putting a mark of the urgent sample. This can help us to be able to prioritize the urgent sample, therefore maintain the turnaround time as expected for samples. Understand me? And your recommendation led to the management, getting a separate cap for urgent samples. Do you understand me? Which then help to prioritize those. So just make things up. You could talk about maybe how you notice a particular procedure can be better. Do you understand? Think about something, maybe something like, even if you say something like rapid malaria test, do you understand me? Then you notice that even though that the SOP said that it should be incubated, you need to make something up. Maybe it should be incubated for 5 minutes. Are you getting me? Then you notice that there was this particular patient that they traveled to Africa. You need to make something up. Are you getting me? They traveled to Africa, and when the thing was done, or maybe when you did it, you notice that it start giving you results after 5 minutes. Do you understand me? And because it start giving you result after 5 minutes, what happened was that the microscopy showed you that it's positive. But the rapid did not give you positive result at 5 minutes. Do you get? Then you decide to wait for 6 minutes, and it gave you a positive result. Then you start querying, why is it giving you positive, whether it's a false positive. But your confidence now was because of the microscopy showed you that it's positive, which is of course the standard way. Does that make sense? Okay. Then what you then decided to do was now thought of the need to optimize the method of carrying out the rapid test. So you went and got the negative control, do you get, and got the positive control. You find out as well that even at 6 minutes, the negative control were still negative, and the positive control gave you positive. Does that make sense? Okay. So that showed that we can actually leave it up to 6 minutes. And then you suggested that to the management, and following their optimization of the methodology, they now said that we can incubate between 5 to 6 minutes. So you need to make things up. Does that make sense?
Yeah.
That's how detailed. Example is the key for this kind of question. Right. Is that okay? Yeah.
Yeah.
Good. Number 2 question. Can you give us an example of a time when you have gone above and beyond what was expected of you to help a patient or colleague? So, what I want us to be doing before we answer any question is to reflect first. What does this thing mean? It's not to run off. So, there are key things here. Can you give us that? The question is a question of example, real time example. Forget that they say, for example, any question they ask you, use example. You see, what I tell people is that the people who are interviewing you, most of them, they've done this lab work matter that when you are talking something that is not real to them, they feel like you're not giving them the correct answer. Do you understand me? So your answer must be as real as what is going on in the lab. So can you give us an example of a time when you have gone above and beyond what was expected of you to help a patient or colleague? So what do you think we can include here before I give you my scenario?
There are a lot. I just don't know how to answer with very good experience, and because this one has to be like a it must be a good answer with good
This one
experience.
is actually simpler than the previous one because this doesn't necessarily have to do with a lab. If you are working, you must have done this. So for me as a lecturer, think about it as a lecturer, even a module that I'm not part of the module, are you getting me? Oh, somebody said, I've been spending time finishing my marking. As soon as I say, let me get rest, and I got an email saying, oh, someone is off sick. Can somebody help to mark? Then do you understand me? I step into mark. For the fact that you canceled your annual leave to come and help because of the department is short staff, that's just what this thing. I'm trying to tell you that it's not far from what you have done already. Let's repeat it. Can you give us an example of a time when you have gone above and beyond what was expected? So you book this your annual leave, and suddenly your management message and say, ABCD has gone off sick. Do you understand me? We are wondering if you could come back and cancel your annual leave and take it some other time. And you accepted. You have gone above and beyond because you have a choice to say no. You book it already. Do you understand me? Do you get it? Huh? Yeah? Okay.
Yes.
So imagine a situation whereby you were in the lab. Are you getting me? Okay.
Yes.
I'm giving you real-time scenario what that goes on in the lab, by the way. Okay. Yeah. So you are a biomedical scientist, and on this occasion, you realize that that the specimen reception, they are very short-staffed, and they were unable to book in sample quickly, thereby slowing down the amount of the sample going through the analyzer. Does that make sense? Okay. And the implication of this is that it's going to make a lot of samples. It's going to cause too much workload to the people who are on late shift. Okay. Then what you then did was to say, okay, you know what, since there is no much work happening, are you getting me, on the bench, this is because of the specimen reception being short-staffed. You decided to go and help them to book in the sample. Are you following? That's also another scenario. You help them to book in the sample. So you were booking in the sample. You were also carrying the sample to come and load on the analyzer. Do you understand me? And all of that. So that way you were able to help them support the specimen reception to book the sample as quickly as possible. And at the same time, help to run the sample to validate it and all of that. So that maintained the turnaround time, meaning that invariably it also support the staff and as well help the patient because the result has come back when expected.
Yeah, that actually answers for both staff and service users.
So imagine a situation whereby there was a situation whereby maybe a doctor asked for a result, and of course this is a send away result, for example. This is a send away result, and you were not able to track the result, and you found out that it appeared that we received the sample. It appeared that the result supposed to have come back, but unfortunately the result hasn't come back. Do you get? And there's no any evidence that the sample was sent. Do you get? And then you took it upon yourself to track when the sample was received, are you getting, and all of that, and you now noted that the sample was not released, do you understand? So you took it upon yourself to find out, and you know that the sample was not sent anywhere, are you getting me? Then you have to retrieve the sample and make sure you send the sample and communicate to the wardens and apologize on their behalf, on the behalf of the lab, that you are very sorry, it's just an oversight, and as the case may be, that you are sending it and it will come to, and also you went as far as communicating to the send away laboratory where you are sending it, that please, this is what happened. If they could prioritize this, that would be greatly appreciated. And that helped them to be able to do their best to give the result on time, and they were able to do it and phone the result, and of course then that get the result back. So that is you taking. So I want you to think in terms of what you could choose not to do anything. You could choose not to do anything about it, but you chose to do something about it. That is what they are looking here. Do you understand? Okay.
Yeah.
Now, let me see if I can think of something else again. So let's say, for example, there was this occasion when you are working, you are doing, let's say, normal shift or late shift, is up to you, anyone that is best for you. But it happened that one of your colleague who's supposed to take over from you, something has come up now from home, and the person was unable to come, when the person is supposed to come, and it apparently means that you then need to stay for extra 4 hours. And you did. These are what you've done. Do you understand me? This is how you are supported and all of that. Okay. So you can also say something like, during expectation of accreditation. In fact, some of the things we answered before, the answers can also come in here. Are you getting me? Good. So now you can also mention that during the time of accreditation, one of the things that, because a lot of paperwork need to be done and the managers are being tense and all of that. And one of the things was that you promised the manager that, okay, that what you are going to do, because of a lot of paperwork that need to be done, that you are more than happy to continue to support them at the end of your routine shift to see that they get the paperwork done. So what you did, you were on the normal shift those week. And when you are on late shift, you come in on time to support with the paperwork. Then when it's the time for you to take over the late shift, you take over the late shift. Or when you finish your morning shift, are you getting me? You usually put in like 2 hours before going back home to help the manager to sort out the paper. These are make things up. So the problem people have that when they get questions like this, they are like, okay, just think it's not far. Think within what you are doing daily. Are you getting me? And give it to them.
I think some of these are actually in line with the person specification, because I'm trying to link them with it, and I've seen lab accreditation too as part of the knowledge. So I think that's a good example. I'm just trying to tick.
So it's important. It's important that you need to show. Are you getting me? That you are proactive in that. Are you getting me? In what you are doing. Do you understand me? So, imagine, let me even paint another scenario. So, this could happen actually in blood bank and hematology and blood bank. So, let's say you can say that you are in hematology bench, and while there is a number of samples you are validating, but you realize that there are 2-3 major hemorrhage going on in blood bank, and it is only one staff. Do you understand me?
Yeah.
And why there are urgent samples as well going on in full blood count, but you were unable to navigate, validating the full blood count samples going on, and also you were also able to go and support your colleague. Are you getting me? To make sure you help to take care of some certain things to help him or her to be able to meet up and all of that. That moral support you gave to that your colleague was able to help the colleague to be able to go through that situation without too much stress. Because you could choose to stay on your bench now. Why going to help the person? These are some things that you need to think. Okay, these are some things. So it's limited. As I said, this is an open check. So the problem somebody here is going to have is the person will give one example and say, "Wow, I ran away." This kind of thing. Keep giving yes. For example, this kind of question, you can say, "What?" That having worked in pathology laboratory, there's a number of things that I've done. In fact, let me even tell you another way. You can say that pathology laboratory obviously is a complex environment, and there are a lot of activity that goes on there, and there is a need to be very coordinative when we're doing something, ranging from leadership and teamwork and all of that. So you can say you've contributed in a number of things that makes you believe, that you're a good biomedical scientist. Just to mention a few. Do you understand me? Then you began to give these examples. Yes. Does that make sense?
Yeah.
When you are giving the example, don't make it look like you are making it up. No. Paint a real-time scenario, you guys, and give it to them. I had to paint a real-time scenario. Said that there was on this occasion I was at work and say it now.
Okay.
So there was one weekend that I was working and okay.
Yeah.
So that's what you need to do. Okay, I think we've done that. Yeah.
Yes, that's
good. So what action would you take following a failed QC? I think you should know this one now because it's on my video.
Yes, I think I should know that one. I'll check it from my notes there.
So when the quality control sample failed, there are a number of things that you need to consider. It's not just that the quality control sample failed. One, you need to check, are you getting me? Yeah. What parameter has failed? Remember, when we talk about quality control, whether you are talking about PTR now, not PTR now, whether you are talking about coagulation, whether you are talking about full blood count, are you getting me? Even whether you are talking about blood bank, like ABO grouping as the case may be. So if a QC failed, it doesn't mean that all the parameter has failed. I hope you know. Did you get what I just said?
Yeah.
So let's say that what failed was hemoglobin and not WBC. Let's say what failed was PT, not APTT. So it's important that when quality control sample fail, we must first of all determine what has actually failed, which parameter failed. That will help to form the next action we are going to take. Do you understand me?
Yeah.
Because the parameter that failed can now help us to decide what we are going to do, the likely actions we are going to take. Now, once we have determined the parameter that has failed, this is where, don't just say parameter that has failed, just say, for example, in full blood count, there are a lot of parameters, maybe red cell indices such as hemoglobin, MCB. Are you getting me? Just listen for them, then talk about total white cell count, differential count, platelet. So it's important to know which parameter failed. Is it neutrophils? Is it lymph? Do you understand the point? So that they know that you know what you're talking about, not just mentioning parameters. You get the point?
Yeah.
Then once you have done that, the next thing we then need to do is to temporarily stop that analyzer, stop using the analyzer. Because you have noted that something is wrong, we can no longer use the analyzer. We then need to stop using the analyzer and do some check. Are you getting me? Okay.
Yeah.
Now, one of the check we need to do is one, anyway, depending on the scenario, is it that the QC failed before we start running the patient sample? If it is before we start running the patient sample, easy. We just need to sort the problem out. But if it is after we started running the patient sample, then we'll do QC maybe in the afternoon and we noted that it fell. Now, what we then need to do is to ask ourselves, has any patient gone through that analyzer? Do you understand me? Okay. Within the time you think that thing failed. If yes, we may need to retrieve that very sample and rerun it in another sample. Do you understand? In another analyzer. Does that make sense?
Yeah.
So basically, we need to determine whether the patient sample that has gone through the analyzer, whether it needs rerunning or not. Okay?
Yeah.
Good. Now, again, when we check the parameter that has failed, we now need to look at the average of the QC liver graph plot. Do you understand me? So to make sure, is it, when I was trying to tell you that sometimes some biomedical scientists, because the QC has passed, they don't even check where has it passed. They keep saying it passed and continue. Are you getting me? It is when you review it, you might find out that this is not a recent problem. Maybe it has been occurring for the last 3 days, but because of lack of investigation, do you get?
Yeah.
The thing continue to deteriorate until that time. All right, okay. Now that's where you can now consider the liver graph. Check the liver graph plot. That will tell you, that can help you to know what has passed and even how it fell. Did it fell on top of the +2 or -2 standard deviation, or did it go like 3? Do you understand me? That will help you to know the rate of how it fell. Okay. Now, we can now be able to check the possible things why it could fail. Obviously, when the QC fell, there are 3 possible reasons why that can make the QC fail. 1, it could be the sample, quality control sample. Okay. 2, it could be the reagent of the analyzer. 3, it could be the analyzer itself. So this is how you need to pick it. Now, when it comes to the quality control sample, it could be due to maybe it has expired. It could be due to because it is underfilled. It could be because of it is contaminated. It could be because it is not well reconstituted. Okay. It could also be because of a different badge number. Okay. It could also be because of it has expired. Do you understand the point? Okay. It could also be because of it is not properly mixed. Are you following me? So these are the points that could cause the quality control sample failing when it is because of the sample itself. Now, if you investigate any of those things and you think is not any of the factors, then you might need to suspect whether it is a reagent. So we can now look at the reagent storage, whether it's being stored in appropriate. We also need to check the reagent date, has it expired or not. We also need to check the reagent lot number, as the case may be. Okay. Then we also need to check is it the reagent, is it underfilled? And another thing that people keep mixing is that there's a hoist pipe. There's a pipe connecting the reagent and the analyzer. We also need to check that it is straightly forward, straightly stretched. You know what I mean? Okay.
Yeah.
Not squeezed or something like that, because that will make the analyzer to aspirate a bubble and not the reagent, and that could impact on that. So again, that is how reagent can contribute to that. But if you check all of that, you think it's not the reagent, then there's a possibility it could be the analyzer itself. Okay. Then you need to check the analyzer by, first of all, checking maybe the calibration. You need to check whether is it current or is valid. Remember what I told you, that calibration pass doesn't mean it's a good calibration. Does that make sense?
Yeah.
So you need to check how did it pass and all of that. Then where possible, you might need to recalibrate. Anyway, you need to check, is the calibration current and valid? Okay. Then you might need to also check possibly if the calibration is not current and valid. Of course, you need to do recalibration. Then of course you need to do maintenance. And when you do the maintenance, this is where knowing the parameter or what I felt comes in. Are you getting me? So that you can focus on that particular parameter that failed and correct it. Anyway, you can do maintenance, and of course, after your maintenance, hopefully everything will be okay. Then what you need to do, of course, is to repeat it again. Hopefully it will pass. Do you understand me? Okay. Now, if it passed, that has been solved. If it didn't pass, do you get? Then what you then need to do is to, of course, put it on the logbook and all of that, and of course, where possible, report it to your senior, and of course, where possible, report it to the engineers to come and look at it. Does that make sense?
Yeah.
Any question?
No, I think that was a full pack.
All right, let's go to the next one. How do you prioritize your workload when lone working?
Based on the order of urgency, or how do I put it?
This is a simple question, young man. There's a way I want you to think when you are thinking about these things. Are not hard. These things are everywhere. This thing now is everywhere. This thing now. So when you are working alone, first of all, let me give you idea what that goes on in the lab. In my opinion, when I was in NHS, there's what we call the shittest shift, like rubbish shift, is late shift. Okay. Now, because late shift is when the GP samples start coming, and of course some samples will still be coming from the ward now, and many people have gone home, so you must learn how to prioritize. Let's leave that aside. There are some lab when, if you work in the lab, you might be the only person. When the last place I worked, I'm always the only person in the whole hematology and blood bank. Do you get the point?
Yeah.
So how do you prioritize such a thing? I can tell you there are many occasions where something has happened in blood bank and it seems like you don't even know what is going on again. Do you get the point? In the hematology. So if you ignore hematology bench because something is going on in blood bank, let's say major hemorrhage, what if there is a sample that has come in the hematology lab that the person is bleeding? How would you know? That you are trying to solve a problem while you are not solving another problem. Does that make sense? I'm going to answer this question, but I want to give you how you need to think technically. So one of the things I do myself then, once I notice, I always go to the specimen reception and say, listen, something is happening in blood bank. Please let me know if there is any urgent sample. Do you understand me? Good. So, and what I do as well, I don't just, what if the person forget? So while I'm doing something in blood bank, let's say I'm incubating something, are you getting me? I'm waiting for something to happen, okay? I can quickly come and rush, do you understand me? And check, because it's not the same location, unfortunately for me. I need to quickly come and rush and check, is anything urgent and validate. So you need to prioritize. You need to prioritize according to how urgent something is. 2, you must be very multitasking and hardworking. 3, you must pay attention to details. 4, you must learn how to ask for help when required. Do you get the point? Now, when you mention this, then you now say, for example, anything you are answering, there has to be example. So let's start with multitasking. So I'm going to prioritize my work when I'm working alone by being multitasking, because it's important, especially, for example, when you are the only person in the lab. This is important because while you are trying to solve a problem, there can be another problem you are unable to solve, and that may not be good for the laboratory. Therefore, what you normally do is to try to be multitasking, then you can paint the scenario. See, now, it's not something you answer. You have to give example. Now, when you say that, you say, for example, there have been on many occasions when maybe I was working, I'm the only person in the hematology and blood bank laboratory, and what happened that there was a major hemorrhage. While you are dealing with a major hemorrhage, you did not lose sight, you see it now, on what is going on the full blood count bench and coagulation bench. This is important because in case somebody come in the hospital bleeding, and maybe the doctor, they need the hemoglobin result, or they need the result urgently to be able to know what needs to do with the patient, you don't want to delay that, you see it now. Or maybe there's someone delivering bleeding at the delivery suite and they sent blood, you don't want to miss it. So you have to be multitasking, and that multitasking allows you the opportunity, while you are solving the problem in the blood bank, you don't lose a sight, are you getting me, of the possibility that can be something else urgent in the laboratory. Now, that's one. Secondly, you can say there was this occasion when I'm working alone in the laboratory. So what has happened is that there was a major hemorrhage going on. Of course, I keep getting a call from the H&E, and at the same time, I got a bleep. You know what is bleep?
Yeah.
Okay, I got a bleep from A&E, and I was trying to call them on my phone, and the phone was ringing, and when I picked it, it happens to be from GP, are you getting me, asking for a particular result. So because there is major hemorrhage, you've got a bleep from the H&E, which again suggests that this could be another urgent, and the GP is asking for a result, are you getting me? So one of the things you told the GP is, okay, that is fine, is this something that they can give you a few minutes? Do you understand me? That you can get back to them, do you understand, quickly, that you have just urgent sample that you are dealing with, and you just got a bleep from the AI, and they were kind enough to tell you, okay, that's why you can call them back as soon as possible. Then that allows you the opportunity to call the bleep and find out, what they requested from you from A&E, and you saw that, and you saw the problem out, and then you carried on with the major hemorrhage, and at the point of incubation, or at the point of waiting, are you getting me, for the result to come out, whatever thing you are doing, as the case may be, or maybe you finish, or maybe when you finish issuing the blood, whatever thing you decide to tell them, then you now give the GP call. Are you getting? Then it happened that they were asking for a result, then you are able to check and give them the patient result. So that's how you prioritize. So you just need to paint scenario. That's what I'm saying. Is prioritizing based on what is urgent. When you are working alone, you got to do something based on what is urgent. And based on what is urgent, how will you determine it? How life-threatening is that situation? I give you an example. You can say, for example, on this occasion, I was working alone. Even though I have sample coming out from A&E that suggests to be very urgent. However, I prioritize a sample from the delivery suite because the woman was bleeding. Are you getting me? And they requested some pint of blood and all of that. Do you understand me? Okay. So even though you acknowledge that there are some sample coming from A&E, but you notice that perhaps the full blood count result, when you look at it, is appear very okay. So you then decide to prioritize more on that of the delivery suite then before coming back to validate all the full blood count result coming from A&E. That something like that. You need to find a way to put it. So your priority is based on the one that is more life-threatening. But I'm saying you've got to paint a scenario. It's not something you can define. You've got to say something that you have done in the past. Okay?
Yeah.
All right. Now, of course, don't forget, in fact, let me give you the answer to this one as well. So don't forget the fact that when you're working alone as well, you can also paint a scenario and say there was this occasion that you were in the lab while you are being multitasking and working hard trying to sort many things out. Unfortunately, the analyzer break down. And because the analyzer has breakdown, it limited how speed you can be able to solve the problem. So, and that kind of impacted you significantly. Now you realize that at this point you really need help. Do you get it now? Then what you did was to go to the lab phone book, okay, and find someone that is living very close to the hospital and give the person a call, and the person was kind enough to come in. That is your ability to recognize when you need help and ask for it. All right. There are so many scenarios coming in my mind, but let me leave it. We don't have that time because our time is actually on. Okay. How have you kept up with CPD? How will you answer
that? Competency test, workshop. I can use my master's as an example. Training also again.
Okay. So how will you answer it?
Advancing, keeping up to my skills of practice. My related to the ACPC conduct also, which states allow you to be within your scope of practice. And
you've not answered this question.
It's because I was asking the same question.
Let me ask you the question again. I'm not jumping. Let me ask you the question again.
Yeah.
How have you kept up with CPD?
Yeah, by ensuring that I'm up to date.
I want to teach you a skills.
Okay.
You've not learned. I've told you this many times today, but I'm going to repeat it. So they ask you this question. Why don't you say that that biomedical scientist as a profession is a dynamic profession, meaning that there's always changes. And that means that as a scientist, it's important that we keep up to date. So, that helps us to know the better way we can be able to deliver our service and maintain, standard. And that is why it's important to be up to date with the help of the continual professional development, which is CPD. So there are different types of CPD, which could be academic CPD, research CPD, conference CPD. I've been opportune to participate in a number of these types of the CPD. For example, I recently completed my MSc in blah, 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 which is an academic CPD. And of course, time to time, I do attend conferences. Maybe I heard, by the way, that place, they like to ask people, which paper have you read? So find one paper and read. Then I try to read some papers, of course, and all of that. That keep me up to date. So that is how I tend to keep up to date when it comes to my professional development. And this is also essential criteria in the renewing of the ACPC. You understand what I'm trying to say? This is the approach you need to use. So learn to give answer without muzzle. Do you understand me? Yeah. Learn to give answer naturally, as if you are drinking water and eating or brushing teeth. Just your answers don't need to come like it need to just flow natural. Learn to make it look like you are gisting them. All right. Okay. In fact, with this kind of CPD, when you say, for example, you just recently completed your MSc in blah, 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 they like to hear those things because you say, for example, then you can also say, in addition, maybe, I'll give you an example. I don't know whether you did. can say, in addition, last year I attended conference in IBMS conference in Birmingham, and there's a number of things that they discuss, something like maybe they discuss this, that, that kind of thing. Okay. Yeah. So I recently read about an article published by this person, and they find it show this, that is very, very interesting because I learned from it. There are many things you can say, even if you decide to read something on digital morphology. Do you understand me? You can read something, you can say, for example, current studies have shown that digital morphology is a significant way that improves the effective diagnosis of malaria. Things like that. Just, and these have been published by Damsey et al. So you just need to make things up, okay?
With this your experience, I think I'm going to hate this question part.
Say that again.
I said, with this your experience in talking, I think I'm going to ace the question part.
All right. Okay. How would you relay an urgent result?
Okay, number one is calling the appropriate channel. Yeah. Also, I'll flag that result on Beams, which is like the normal thing. But this is talking about relay, so I'll inform the right channel. Might be the consultant, because you're telling me something about, like, in a situation of ITP, or in a situation of ITP, then, or a situation where we have leukemia, we suspect leukemia, and this person is not a known patient. The first thing is to call the ward. If it's A and E, or how do I put it again? Just call the right channel.
This guy, they form my handle. Okay. See, when you guys go for interview,
yes,
we say they didn't give me job, they didn't give me. Sometimes these things are not very. Can we just do our best? Then we know there is normal politics, but let's do our best. This is the question. And I've given you this example at the beginning. How would you relay an urgent sample? Again, you've not learned what I've said. You are always in a hurry to give.
Yeah. It's because of our time. Yeah, I don't want to.
You're always in a hurry. So why don't you say something like, well, in pathology laboratory, there's a number of results that when we obtain like this, it's important that once we are very sure that this is a true result of the patient, it's important that we find a way to give that result out in such a way that we make sure that the patient received appropriate treatment. For example, in a case of urgent sample, let's say things like newly presented leukemia. It's important you give that example. Let's say in a case of newly presented leukemia, or in a case of maybe ITP, or in a case of maybe even TTP, or in a case of maybe AML, you just name them. Perhaps in their practical question, they have asked you those things. So that now give you the opportunity to name these things. So say, for example, in such situations, what you are going to do is to call the hematology consultant. Now, it is important that I relay this information to the hematology consultant, and with the professionalism of the hematology consultant in most cases might decide to tell you, okay, you can call the ward, I get him, and let them know. But in most cases, they usually call the ward themselves. Do you understand me? Because then they may need further detail about the patient to be able to make a decision. Do you understand me? Okay. And of course, where possible as well, you can also call the ward themselves and let them know that, okay, you've also informed the hematology consultant, and the hematology consultant said that they are going to call you back. That is important that you relay this information as soon as possible, because in some cases, if this is not properly done, the patient may be discharged, and that can delay the patient management. Does that make sense? It's important. Yeah. So when you say appropriate channel, it doesn't say anything.
Yeah.
You understand me? You've got to say, for example, let's say, for example, are you getting me? Give the example of the conditions, the urgent result here. Okay, let's forget about what I've mentioned. What in a case of where there is we got high INR of 5 point something. Are you getting me? So that one now, you don't even need to call hematology consultant. You see now, that's why example comes in. Okay, so in such situation now, because of high iron, now then what you need, that this is urgent, because if it is not properly monitored, the person might bleed to death as the body system, as the person's system is becoming watery. Do you understand me? Therefore, you are going to call the ward and let them know urgently that this person's iron now is 5 point something or 5.0. Do you understand me? That would then help them to see how better way they can manage the patient, or as the case might be. I hope that, so you've got to give that real example. What a situation whereby there's a low hemoglobin, severe low hemoglobin. Are you getting me? Now you don't need to call the hematology consultant. Is a word again. You call. So by the time you say for example, and give them an example where you need to contact hematology consultant, or give example where you don't need to contact the hematologist, you just need to contact the ward directly. It shows that you have this experience. What about in blood bank? Do you understand me? Okay, whereby for example maybe there, oh, this one, if I tell you this now, will it be too much for you now? Okay, it's not a result. Let's leave it. Okay, let me tell you a result. There's something I want to tell you, but I think it may do your brain. So let's leave it. So now let's say in blood bank, and you've done there's a patient that has a historic antibody. Are you getting me? Okay. Now the ward is pestering that they need a blood. Are you getting me? And they can't wait for cross match and all of that. Okay, so because the person's result has you've just found an antibody, and the ward is pestering you for issuing blood. I get it. They can. It's important that you also notify the hematology consultant about the situation, and of course notify the ward about the need to consider cross-match and all of that. And of course, if at the end maybe you follow the guideline of the hematology consultant, but in some cases maybe they can sign a concessional release form and as things like that. Okay, it's important you are as specific as you are. Those things are already on my YouTube channel. What I have found out is that people don't go through my channel in details. A lot of answers are there. That is why I'm not even keen to make too much videos these days. Anyway, can you give an example of a change or quality improvement you have recommended, suggested, or implemented at work? I've given you an example of this. Can you remember the one I've told you today?
Yeah, you talked about one about identifying samples, urgent samples.
Yes. So
yeah. Don't look at your time. Time is.
So that is the one I've told you. So whereby you find out any possible ways that things can improve. Do you understand me? Okay. Maybe the best way that you've suggested, the best way it can help us to process the urgent sample quickly by getting a separate cap that can help to identify the sample quickly, so that we can load it on the analyzer, or at least prioritize it. Okay. So, and the management bought the idea, and then they ordered some different cap colors that can show different word and all of that. Then you can paint a scenario of maybe, even if it's rapid malaria, whatever thing you want to paint. Are you getting me? And say you follow the SOP, but you notice that the results start giving you a positive result, maybe at a later, maybe just add 1 minute to it. Are you getting me? And then you optimize it and find out that that can be a correct answer, okay, and of correct result. And of course, you do notify your senior and let them know that the other time when you are performing that test, the result shows you positive as 6 minutes instead of 5 minutes. And even when you double check the rapid test with a positive and negative control, you find out that at 6 minutes it can still give us a correct result. So you are wondering if we could optimize our method. Are you getting me? Then, and which they bought into the idea and optimized it, and then it was then changed to incubate between 5 to 6 minutes. Make something up, brother. Make something up. All right. Final question.
Final one.
Because 8 and 9 is the same.
Yeah, 8 and 9 is the same.
What do you know about lab accreditation, and how do you apply it to lab practice? This question is 2 in 1. 1 is, what do you know about accreditation? 2, How do you apply it to real life practice? I'm looking at you now. Answer. The way you guys turn me to talkative, eh?
No, it's like you don't understand. You have so much experience. See, I'm wasting my time. I know I would hard up, but I'm wasting my time if I'm like painting. Like I like to draw the ideas for you, and now you draw it. It makes me paint other scenarios, and so
For you. Okay. Now, of course, laboratory accreditation in itself is a way of ensuring that each laboratory they are functioning as recommended by ISO 15189, and this is consistent as well with the UCAS standard, because UCAS is a member of ISO laboratory. Do you understand me? Okay. Now, what will happen is that UCAS have a standard of what is expected, and in addition with the UCAS, things like, don't just mention only UCAS. So in addition to UCAS, there are other regulatory bodies such as maybe MHRA, okay, maybe HTA and all of that. So with the collaboration with each of these other regulatory bodies, so there are full regulation of requirement of what the laboratory is expected to meet up to be able to be accredited. Obviously, once the laboratory meet up with that very standards or the requirement, and this ranges from maybe the personnel, give them example. It ranges, for example, the personnel,
essentials,
for example, qualification of the personnel, equipment, things like that, environment, just name it for them. Do you understand? Documentation and all of that. So it ranges from all of that. So once the laboratory meet up with any of this, they can get accreditation. Now, that doesn't stop there, because the system will continue to monitor to ensure that the laboratory continue to follow the standard. And in view of that, and in ensuring that there's always annual inspection. Do you understand me? So they're always going to visit, and the visit is to make sure that they keep the laboratory, making sure that the laboratory continue to meet up with the standard. Now, when they visit the laboratory, then they check all of those their standard standard keynote, like the key points of what they are looking at, and then when they check it, it also helps them to be able to recommend areas of improvement, that even though that UCAS themselves, okay, or ISO 15189, even though they may have make a standard, sometimes within the 1 year there can be some modification, and that then need to be implemented in their next visit. Do you understand me? And sometimes they can notify the laboratory of the new implementation, telling the laboratory to also update their process up to the current update. That way, when they visit, they also want to see that. Now, how you've applied this in real practice is because that the UCAS or ISO 15189 is entirely all about quality management system. And interestingly, the quality management system in itself is everything that goes on. Are you okay? It's everything that goes on in the pathology laboratory. So in real practice, what it then mean that you as a person, as a biomedical scientist, you are also working to ensure that all your actions, your decisions, everything that you do in the laboratory is consistent as prescribed by ISO 15189, and of course as prescribed by UCAS laboratory as well. So for example, when it comes to things like you carrying out a quality control before performing a patient test, this is a recommendation by the ISO 15189 and of course UCAS. Okay, when it comes to you identifying maybe the possibility of maybe storing the reagent appropriately, taking reagent stock and all of that, these are recommendations of the ISO 15189 and of course UCAS. So what you just need to do is, again, give them example of everything you do in the laboratory is ISO 15189 and UCAS. What that question means is, do you recognize the role of ISO 15189 and UCAS in maintaining standard? So because you recognize the role, that standard will be what they are going to give the laboratory to maintain accreditation. Then, even when they've accredited the laboratory, they continue to inspect the laboratory. Do you understand me? That way is to continue to have assurance that the laboratory are fulfilling the requirement. And of course, if there's any changes, then they can also recommend to the laboratory. Now, how does that concern you? It concerns you because everything you are also doing is to reflect ISO 15189 as recommended by UCAS bodies. Okay, then you can say, for example, in UCAS inspection, like accreditation laboratory, there's a number of things that they check, ranging from the personnel. As a person, it means that you have to have the right qualification, right registration, that kind of thing. So as a biomedical science, for example, you have a degree in biomedical science, you are HCPC rated, things like that. So that allows you to, so that's how you do it in practice. Quality control that you are doing is also the other thing. You're making sure that every even when there is an incident, are you getting me, that is properly documented. These are all recommendations. So basically everything you do in the laboratory. Okay?
Yes.
Happy days.
Thank you very much.
Right. I
hope took too much of your time.
No. I wish you all the best.
Yes.
What I'm going to tell you is this. This is why people don't know. There are some information that I can't put on YouTube. It's too much. Even what I've told you now, even though I'm going to still put it on the YouTube, there are still so much. Where it's coming from, there's so many things there. So, and what you need to do tomorrow is not to be nervous. What you need to do tomorrow is to bring out this information naturally.
Yeah.
Make your answer to be very, very natural with you. Anyway, thank you very much.
Yes, thank you.
I wish you all the best. Let me know how you get on.
All right, thank you very much.
When you get the outcome,
please
prioritize the other jobs that you've gotten. They decide the one you are going to pick. Okay.
Yes, thank you very much.